Experience holiday cheer at Tanger Outlets with savings up to 70% off your favorite brands. From fragrances to accessories and the latest styles, discover the best gifts for everyone on your list. Save big at Nike Factory Store, Michael Kors, Under Armour, Coach, Polo Ralph Lauren, Kate Spade New York, and so many more. Unwrap the best at Tanger Outlets. Hundreds of brands, endless gifting options. Plan your trip at Tanger.com.
We always get together with our friends at Mercy Health for What's Up, Doc, out of our 8:30 news. And this morning, we are going to talk with Dr. Gregory Richards. And we're going to talk about oncology, radiation oncology, and other things that fall under the realm of it being his specialties. Greg's been on with us before. Dr. Richards, good morning.
Good morning, Riley and Joe. Hope you guys are doing great on this freezing cold morning.
We are. Any doctor recommendation other than don't go outside?
Yes. If you do, stay warm, wear lots of layers, and make sure you protect yourself. Keep your exposure time minimal.
Yeah, I saw, some of that, the game between the Packers and the Vikings that was on the other night, the Vikings head coach, what's his name again?
Mike Zimmer.
Mike Zimmer, looked to me like a guy who would be wandering around outside a station in Antarctica that they need to bring in because his face is going to fall off.
His face turned cherry red.
Yeah.
Yeah.
And I often point out, I'm no doctor, but that can't be good for you.
Oh, absolutely not. No, absolutely not. So today, I was hoping to talk to you guys today about lung cancer.
All right.
Just because it's an issue that obviously afflicts many people, and in fact, it's the second most common cancer diagnosed in adults, and it's the number one killer. So, I wanted to just discuss that a little bit with your listeners. And the first thing I wanted to tell them is that in the old days, we used to see a lot of patients come in with lung cancer with lots of symptoms, cough, blood in the cough, inability to breathe. But, we have new guidelines that have been out that allow us to catch this disease much earlier. So the CDC, and we all know the CDC now over the past 2 years, they have criteria out for lung cancer screening, and we have a pretty robust program here at Mercy Health. And so those are patients who have a history of heavy smoking, continue to smoke or quit within the past 15 years, and are between 55 and 80 years old. Those patients are eligible for what's called a low-dose CT screening test. What they do is they do a CT scan, and they can look for small nodules, things like that. And with those nodules, if they see any, they would either repeat the scan in a shorter period of time or potentially do a biopsy. And by doing this, we're catching lung cancers much earlier and making it much easier to treat people and hopefully cure them.
You said one thing I don't think I knew, that lung cancer leads in fatalities. What causes one cancer to be worse than the other? I don't know if I told you last time you were on, but I'm a cancer guy. I got testicular cancer about 4 or 5 years ago, and I'm sure you know the spiel. I talked to doctors. I was never concerned because every doctor I talked to said, "We know what we're doing. We're gonna kick this out. You'll be pretty all right in about 5 months." So it seems like we figured out testicular cancer. Did it take us longer to figure out lung cancer, or is it just more invasive in the center of the body? What's the difference between those cancers?
Yeah, so the thing about cancers, we think of it as one diagnosis, but it's really, we have many, many different types of cells in our body. Obviously, a brain cell's different than a muscle cell. It's different than a lung cell or a breast cell. And when one of those normal cells turns into a cancer cell, it begins to grow basically uncontrolled. And so just as those cells are all unique, the cancers that they can form are equally as unique. And lung cancer tends to be more biologically aggressive. It also tends to be a disease of older people and also people who have a history of things like smoking, so their general level of health is lower than, let's say, someone like you you were younger when you had your testicular cancer. So there's a lot of different reasons, but it's just biologically a very aggressive cancer, and we tend to catch it later in its overall course, what we call a later stage. That's why this lung cancer screening I was talking about is very important, because that is a way we can catch this otherwise very aggressive type of tumor early, and the earlier we can catch it, the more we can do about it. And that's things like surgery or radiation therapy or chemotherapy or even lots of new modern drugs out there. But it still is, if you want to talk about sort of survival rates, the 5-year survival rates according to the American Cancer Society, severity, for localized lung cancer, it's about 63%. For regional cancer, which means spread to the lymph nodes, about 35% 5-year survival rate. And for people with distant spread of the lung cancer, it's only 7%. But those numbers are improving, particularly with new modern medical therapies. In fact, the New England Journal had a paper published in the summer of 2020 that showed that lung cancer survival rates are going up, which is very important. And we have just new medications coming out all the time that will continue to improve those.
Dr. Richards, tell us a little bit about radiation therapy. How does that work?
Yeah, so now you're right in my wheelhouse. So I'm a board-certified radiation oncologist, and so what I do is I use high-energy radiation to treat tumors. And so typically that's high-energy X-ray beams or things called there's other types of radiation called proton beams that we use to treat radiation therapy. Now, here at Rockford, all the cancer centers, we use X-ray therapy. Proton is still a little bit of a specialty treatment. But what we're doing is we're shining in these high-energy X-ray beams to the lung tumors and the surrounding areas like lymph nodes that may be involved. And we're trying to cause damage to those cancer cells while minimizing the damage to the neighboring normal tissue. And so oftentimes patients getting radiation therapy will have a number of treatments. So for instance, let's say someone has an advanced lung cancer and they're getting radiation therapy with chemotherapy at the same time. We might be giving them a small dose of radiation once a day, 5 days a week, over 30 total treatments. If someone has an earlier type of tumor, we might be able to just treat that with a much higher dose of radiation and a lower number of treatments. And so, but radiation is very effective against eradicating lung cancer, particularly if caught early.
Doctor, this isn't on you. You're a great speaker and good teacher. But I understood maybe half of that last sentence you said. How far back in time do we have to go for fellow doctors not to really understand what you were saying? That it's a science fiction to them. Are you talking going back 5 years, 10 years, 20 years?
Yeah, and so some of this, the beginnings of some of this these technologies, go back about 20 years. But in the medical world, when we have a new technology, it usually takes a lot of time to bring that technology to the forefront. With COVID and these vaccines, we see a new vaccine come out very quickly, but that's not the norm. And so a lot of these new drugs, they take many years of clinical trials to determine are they effective, and if they're effective, how can we apply them? For instance, this high-dose radiation therapy, which is called stereotactic body radiation therapy, we first started seeing publications of this in the early 2000s. Now it's 2022, and it is standard of care. And so it could take a good, 10, 15, even longer for something to become from an experimental treatment into a standard of care treatment. But as medicine gets more modern, I think that time frame is shortening.
Yeah, I was going to say, you seem to have an optimistic tone to your voice, Doctor. I'm guessing that if you and I were to have this conversation, Joe, you and I sitting around here, in 15 years, we'd look back and go, I cannot believe how quickly these things accelerated.
Yeah, absolutely. No, I mean, it's kind of like the old Star Trek movies. When they come back in time, they say, boy, they're still doing this type of treatment. I think in 20, 25 years, there'll be so many advancements that we're looking at much, much better survival rates, even for lung cancer. And we see that now.
Well, if you get one of those Dr. McCoy things, you just hold in your hand and wave over the length of somebody's body and tell them to get out of your office, that's going to free up for some golf, I'm thinking.
Yeah, the tricorder. I wish I had that, but unfortunately we still do not. So a lot of physical exam and a lot of radiology studies and things like that to figure out what's going on.
I want to rewind a little bit. You talking about a new screening process you guys are using. What's the procedure there?
So again, if a patient meets the criteria where they have a heavy history of smoking, and that typically means a 30-pack year history or more, so that could be someone who smokes 1 pack a day for 30 years or 2 packs a day for 15 years. If they are continuing to smoke or if they've quit within the past 15 years, and if they're between 55 and 80 years old, they're eligible to have what's called a low-dose CT. It's a screening CT scan where the radiation dose of the CT is very low, but we're able to see the lung tissue in great detail. And then what we can see is small nodules. And if those nodules meet certain criteria, either we do a repeat scan in 3 or 6 months, or they may be eligible for a biopsy. And if they have a biopsy, we would then determine, is this a cancer or not? And by doing that, we find basically tumors that are much earlier in their stage, which means they're more newly developed. And when something is earlier in stage, we have a much better chance of being able to treat that to cure it.
When you say scan, are we talking about MRI, CAT scan? Okay,
CAT scan.
Non-invasive, right?
Non-invasive, non-painful. It's a CAT scan, so it's a very low energy X-ray scan, but we can see then the lung in 3 dimensions.
Doctor, for people who have been listening to this and didn't realize this technology, this sort of screening exists and anything else, and it is clip the light bulb on over their head, how do they follow up with you, with Mercy Health, to get themselves involved?
Yeah, certainly you just give Mercy Health a call and just let them know they're interested in either the screening or they could always contact their primary care doctor and let them know, hey, I heard that, I meet certain things that might make me eligible for a screening test, and then their physician can discuss it with them if it's appropriate for them. But they certainly can give Mercy Health a call and ask for the lung cancer screening program.
All right, Dr. Gregory Richards, we appreciate this. You were on with us before. We love the fact that you got talked into it or volunteered to sacrifice yourself for other medical personnel to come on with us again. We would love to chat with you again in the future, too.
Anytime, Riley and Joe. Always a pleasure. Thanks, guys.
Thank you.
It's the Ford SUV Season Sales Event at your local Ford dealer. That's where you'll find great offers across the entire Ford SUV lineup, including Ford Escape, Expedition, the built wild Ford Bronco, and America's all-time best-selling SUV, Ford Explorer. Hurry in for amazing offers across a huge selection. This is Ford SUV season. Let's get going. Based on S&P Global Mobility 1946 through current U.S. total new cumulative registrations for all vehicles identified as SUVs.